anemia who'd been in the hospital for more than 3 weeks. She weighed almost 600 pounds and was brought to the hospital ER by paramedics after firefighters broke part of the door frames of the house to get her out. She was completely immobile and couldn't sit up or walk. In the hospital she was put on an 800 calorie per day diet, and she hadn't lost a pound. It turned out that she complained to family and friends about her strict diet and they snuck food in for her. When the nurses told me this I was astonished. What her family and friends were doing was the equivalent of helping a suicidal patient tie the knots on a noose and then help set up the chair. I have morbidly obese cancer patients. I tell them that if they can lose weight and exercise, they will probably lower their post-surgical relapse rate by a relative rate of 30%. In other words, whatever their relapse risk is, they'd reduce it by 1/3. That's a pretty good number considering all the other health and life benefits that would result as well. That degree of reduction is also about what chemotherapy does for many common cancers, including the most common kind of breast cancer. I give them dietary suggestions including food choices, meal timing and more. It's not uncommon for my patients to come back for their next checkup and weigh more. I refer them to nutritionists and sometimes I refer them for consideration